Good morning, Dr. McHenry coming to you on Thursday, May 21st. Arizona is opened back up. We're all getting back out there and starting to return to some form of normalcy. So with that being said, I want to talk about a few things. Navigating your experiences back out traveling, going to work, etc. If anyone has any questions regarding safety, what their specific personal plan should be, how they should handle themselves or conduct themselves out there, please feel free to reach out to me. We can have a telephone call, we can have a visit, we can have a virtual visit and discuss your specific personal plan. What do I do to stay safe? I'm getting my sleep, I'm staying well hydrated, I'm exercising daily, and I take 2 supplements every day. Actually more than that, but these are the ones. Mitocore, an immune booster, stimulates cellular energy production and functions somewhat as a multivitamin. So 2 of these twice a day, and the other thing that I take is called Viracid, and Viracid is an herbal antiviral. So I take 2 of these twice a day as well. On top of that, vitamin D is very essential. It has been shown that people with higher vitamin D levels are more immune to the COVID virus infection or consequences. So be sure to take your vitamin D. You know, I tell many of you that you're low in vitamin D and you need to be taking your vitamin D daily. Secondly, masks, wearing masks back out in public. We have different masks. We have the standard surgical mask, which I wear in the office. These are disposable. We have cloth masks that can be worn that are just made of cotton or other materials. We have the US certified N95 mask that looks like so. There are various versions of this. If it says N95, that is US certified. Lastly, we have the KN95, okay? So it has a little KN95, the letter K, N95. These are the Chinese certified N95 masks. I prefer the US N95s, but if all else fails, you can obtain KN95 masks relatively easy. For those of you who are higher risk, those who are elderly, those with chronic underlying conditions, please try to wear the N95 or the KN95 mask when out in public. The rest of us can wear the disposable masks, the cloth masks, because we're just trying to prevent our germs from getting to others. Social distancing. It is our personal responsibility to social distance as best makes us feel comfortable. So if you're in a store and someone pulls up alongside you and parks right next to you and you don't like it, just move away. Keep your own distance. I still suggest not wearing gloves and just being very good with hand gel and hand washing and being very careful with those. I also want to talk about the multi-system inflammatory disease that they're reporting on the news in children. This is a very somewhat deadly condition in children. It's exceedingly rare. It's an autoimmune syndrome that adolescents 18 and under get post-COVID infection. So a couple of weeks after having the COVID infection, they seem to have this autoimmune reaction, which is an inflammatory condition throughout the body. It can be very dangerous for them, but again, it's exceedingly rare. Only 200 cases in the thousands of children who have been diagnosed with COVID. So again, exceedingly rare. However, any adolescent 18 and under who develops abdominal pain, fever, rash, post-COVID infection, or even if you don't know if they've had COVID and they have those symptoms, please have them evaluated. With that being said, I want everybody to stay safe out there, enjoy the Memorial weekend, and please reach out with any questions. Thank you.